We are surrounded by people where we shop, travel, and live. Fundamental to our existence as human beings and our well-being is our state of mental health. It is key to understanding others so as to interact with them successfully and ourselves. In this brief seminar for the POINAR Changing Faces, Changing Lives, Promoting Positive Mental Health, in the time we have, we're going to look at what mental health is, some common conditions to be aware of, and a few ideas we can look at to improve our mental health. The importance of mental health, in other words, why it is significant, and a quick way we can respond to emergency situations involving others who may be at risk or committing suicide. In the past, mental health was defined in terms of being an absence of mental illness, but there are people who have been diagnosed with a mental health condition who are enjoying a positive state of mental health, and there are others who have not been diagnosed with the condition who are struggling. So it's more helpful to think of mental health in terms of a continuum and to be aware that our states of mental health can change, checking on others and also asking ourselves where we are and what we need at a given moment to boost our mental health as we try to move towards the best state of mental health possible for us as individuals. What is mental health? How we think and feel, cope, behave and function, how we interact with the world, how we operate in society, how we cope from day to day with our experiences, challenges, stresses, responsibilities, how we're able to flourish and reach our potential, our lifestyles and our life trajectories. So thinking about the significance of mental health, it clearly impacts every aspect of our lives.
And especially with the pandemic and the coronavirus, we're hearing that mental health is being a main issue, for children and for young people.
Absolutely. Mental health conditions frequently begin when people are relatively young. In fact, this came as a surprise to me, and maybe one to you too, that half of all the mental health conditions people experience are identified by the age of 14. So this idea of how we feel about ourselves and our futures is so important, and it may be no coincidence that a lot of mental health conditions begin right at a time when people are forming identities and beginning to establish an idea of our place in the world, and then that terrible figure of suicide being the main cause of death among 29 to 45-year-old men. That's really very significant, quite saddening and just mind-blowing. That in itself is a pressing issue. Again, thinking about our lives, our futures and our place in the world around us may go towards explaining why another group has relatively high rates of diagnosis and sectioning compared to the population in general.
I think it was really good to hear a black male's perspective for that interview to happen. Mental health is particularly high within the black and ethnic minority community, and particularly high among black males.
Black males face a lot of challenges. They have a lot of barriers. Black men have to really fight for their future, and I think that contributes to their mental health. The word is demoralizing.
I found a source that explains this a bit and basically talks about similar things, i.e. racial trauma. If it was any other kind of abuse or trauma, for example narcissistic abuse that someone is experiencing, or domestic abuse, we would probably understand why people sometimes become disenfranchised and pull away, and I think people can do that mentally. So we can see the significance of mental health in how it affects specific groups in society in particular ways. And mental health conditions can affect anyone and people from all walks of life. We can often see evidence of this in the settings we frequent from day to day. So looking at the significance of mental health in terms of the scale, we mentioned that 1/4 of people in the UK are expected to develop a mental health condition every year. Please note that these figures are for the pre-pandemic period, so they refer to the situation before the COVID-19 pandemic came onto the scene. Figures for the pandemic period, and also, please God, the post-pandemic period when the pandemic is over, are also something to keep an eye on. So the sheer scale of what we could term the mental health pandemic also points to the huge significance of our theme.
There's a lot of figures that are experiencing mental health, especially celebrity figures. You know, recently we've heard about, I think it was Prince Harry that was talking about how depressed he was at the death of his mother, Princess Diana. And you're hearing other people that are coming forward and they're talking about depression and stress, you know, and you could be a celebrity, you could be a member of the royal family. It affects everybody.
So we're looking at a pressing social issue that people are becoming more aware of, and this is welcome. So the significance in all aspects of our lives, the effect it has on individuals, it's the differing effects on whole sections of society, and the scale of the crisis all show that it will be wise not to take our mental health for granted. Individually and collectively is something that we should always be thinking about taking active steps towards. The significance is in the effects on individual lives and how we as individuals, as organisations and as a society will be wise to find out as much about mental health as we can. Now that we have looked at the importance of mental health, let's look at some common conditions that can be a challenge, so that rather than trying to diagnose people, we can at least begin to have an idea of what might be happening. And of course, with lists of symptoms, people might not necessarily experience all of them. One general category is that of psychosis. Here are some of the symptoms you might see. There are difficulties with concentration, confused and/or delusional thoughts, hallucinations, which are commonly auditory or visual but can involve any of the five senses. A person affected might withdraw socially, and there might be a disconnection from reality. Psychosis can occur in a number of conditions, such as bipolar disorder, schizophrenia, chronic depression, or it can be drug-induced. With schizophrenia, along with psychosis, further symptoms used to diagnose the condition involve effects on behaviour, such as challenges to the person's ability to function socially, like agitation, a lack of motivation or capacity to carry out responsibilities. There is a group of other conditions that are sometimes categorised as mood disorders, which include seasonal affective disorder, bipolar disorder, premenstrual dysphoric disorder, which was established as a condition quite recently. And looking at depression in more detail, some different types are postnatal, seasonal, including seasonal affective disorder, and clinical depression. Some symptoms are there can be a low mood, a loss of appetite, motivation, concentration, enthusiasm, energy, and tiredness, sleeping difficulties, changes in appetite, low self-worth or excessive guilt, social withdrawal, thoughts of self-harm, death or suicide. To look at bipolar disorder in more detail, this is characterized by long-lasting phases of high and low moods, although the high moods are sometimes rather subtle. During the high phases, there can be over-optimism, euphoria, grandiosity, intense energy and a lack of sleep, difficulties concentrating, a racing mind, risky or reckless behaviour. And during low phases, a person may feel sad, hopeless, guilty or worthless. They may experience fatigue, mental lethargy and insomnia, irritability, appetite changes, difficulties with concentration, a racing mind, risky or reckless behaviour. And during low phases, a person may feel sad, hopeless, guilty or worthless. They may experience fatigue, mental lethargy and insomnia, irritability, appetite changes, difficulties with concentration, thoughts of suicide. They may also experience the symptom of psychosis, including hallucinations, thoughts of suicide or death. Anxiety is another umbrella term which can refer to various types or disorders such as generalized anxiety disorder, obsessive compulsive disorder, phobias, post-traumatic stress disorder, and social anxiety. Some symptoms are extreme worry or fear that can at times turn into distress. Moments of stress, distress, or panic can lead to physiological symptoms such as a racing heart, shortness of breath, difficulties with thinking, and you can see people with anxiety disorders avoiding situations that are the original focus of the anxiety. Some other conditions are now more commonly thought of as being a mental health condition or as having a psychological component, such as addictions, for example, to alcohol, drugs, sex, food, gambling, Alzheimer's and dementia, eating disorders, and personality disorders. So there are various other factors that can be involved in the development of mental health challenges and also in treating them. For example, trauma and bereavement. In our group discussion, Brenda mentioned another significant factor, which is stigma.
Sometimes, mental health has been stigmatized for certain groups of people.
Yes, stigma can affect communities differently. It can also have an influence in how people are able to access services. The stigma that people with mental health problems deal with is sometimes worse than the symptoms itself. We mentioned social influences, nature versus nurture. Sometimes genetics can be involved in mental health conditions, and also nurture and childhood experiences. And stress can also be an exacerbating factor, as Brenda and Eileen mentioned in the group interview. They both had, as Eileen put it, layers of stress building up in their lives. The stigma that people with mental health problems deal with is sometimes worse than the symptoms. Difficult physical health problems can also trigger mental health challenges. Now that we've thought about what mental health is, why it's significant, and some common mental health conditions, we're going to look at some of the things that can help to promote mental health. And for this we will use a model referred to as the dimensions of wellness, because while these categories have changed over the years, they provide a good general overview of holistic health. We will refer to the version that uses the acronym SPICES because it's easy to remember. Cinnamon is apparently good for blood sugar levels. People are using turmeric for all kinds of things. So the whole idea is we can think of these elements as being like spices, which all have their own qualities and benefits that they can add to our lives, just like a little bit of spice. The spiritual aspects of life. People have different beliefs, and we are coming from a Christian perspective, from a Christian worldview. And for us having a belief in God, and we have found that a relationship with God can be like a buffer that stops us from falling too far into hopelessness and despair.
What I would say, if you're going through a situation right now, want you to realize, like what my mum said, nothing stays the same forever.
Yeah.
Change will come. That everything is subject to change except God.
So this can be an antidote to basing our sense of self, happiness and well-being on external factors that are subject to change. So we've mentioned the spiritual aspect of wellness, so let's turn to the P of spices, and that stands for the physical dimension of wellness. The connections between the body and mind are more complex than we have realized in the past. For those of us who believe, just remembering that God is a good God who is for us and not against us has been invaluable beyond natural strength when situations are beyond ourselves. We have found that a faith beyond what we can see has made an immeasurable difference to our mental health. And we are now just beginning to appreciate just how complex these connections really are. Many things that enhance our physical health also increase our mental health.
And those are the things that we need to tap into, whether it's to exercise, whether it's to have the right diet, the right foods to eat, whether it's to get to your 8 hours a day sleep that you're meant to be getting. We have an acronym called New Start. N is for nutrition, E is for exercise, W is for water, S is for sunshine, T is for temperance, A is for air, R is for rest, and T is for trust in a higher being.
That gives us a very good overview of ways to promote our physical health. And the T in New Start again relates to the spiritual aspect. The medical model of health has been the predominant approach to medical treatment and also to healing in Western society in particular, looking at physical causes and physical solutions. So that has often involved medication. Some people have found essential, perhaps taking away the extremes of conditions or helping to manage distressing symptoms and potential or actual crisis moments. Some have looked at medication as taking away the extremes of the condition and even seek to treat them in additional or alternative ways.
Turning to I, this is for intellectual.
We talked about monitoring our thoughts and feelings and working on those, and we also spoke about learning something new. The C in Spices refers to community. Joining support groups, volunteering and participating in a positive way has been something we have found very helpful to recovery in our group. Now looking at the E of Spices, this stands for emotional. We talked about the connection between our thoughts and our feelings and how they can feed off each other.
As Brenda said, we need to find ways for ourselves as well to be able to reduce stress and anxiety and mental health and find what works best for us, you know. And I think the main thing is to be able to talk to people. Everyone should have at least that one good friend, hopefully, that they're able to pick up the phone and speak to, you know. And I think talking about it helps a lot, you know, rather than keeping it bottled inside. Or even as Brenda said, having a pad and a paper and writing it down. You know, there's many different creative ways, you know. So speaking therapy, writing therapy, whatever works for you.
Balancing stress with things that help us to feel better, such as relaxation, or perhaps talking to someone, chatting to a friend, doing something nice for yourself, or reaching out to others.
There's a way we can balance negative situations with good ones.
And finally, the second S, the last S of Spices, refers to social. So this is about building positive relationships. Perhaps we could
Evaluate
the quality of our interactions. It can be useful to think of those in our inner and outer social circles. Another aspect is our social media usage. Apparently, being on social media and passively scrolling without interacting, or spending more than 3 hours a day on social media,
apparently not particularly good for mental health.
Understand what you're saying there, because it can become very addictive as well. And I think it's important that you have a proper balance, because especially when you're going through mental health, it can affect you in a negative way, you know, because you're not getting enough rest, you're not getting enough sleep, you're not having that quiet time that you need to have, you know. So I think it's important, you know, to switch off your phone sometimes, because I found that was happening to me. I was on a social media, I was on the phone a lot, and it became addictive, you know. So at times, sometimes I've learned to switch the phone off when I go to bed, and I can have that quiet time.
these individual spices can be the basis of questions that we can ask ourselves. Am I getting enough sleep, exercise, my nutrition? How are my relationships contributing to my mental health? How am I contributing to the mental health of others? And finally, we've mentioned checking up on our friends, loved ones, and those around us. Also, the pressing problem of the high rate of suicide. We found this helpful acronym, LEARN, and who knows, this approach by Forefront Suicide Prevention might help us to prevent somebody from taking what has been referred to as a permanent solution to a temporary problem. LEARN. look for warning signs. For example, people talking about death, self-harm or suicide. Some people make posts on social media that are a sign, or maybe express feelings of hopelessness. It's very important to approach the situation with empathy and be ready to listen rather than trying to solve the problem immediately. This will build trust and may be enough in itself to just give the much needed outlet that may reduce the desire to take that step. Similarly, asking someone if they are having thoughts of taking their life is not likely to give them that idea, but can interrupt a possible situation by providing a release in allowing them to talk about it. Removing the dangers such as excess medication by only allowing what needs to be taken at a given moment.
Actual weapons and makeshift
Weapons can also help to save lives. The next steps may include contacting emergency services or accessing treatment.
Just the message that needs to go out is that mental health, it does affect everyone, but there are positive ways of how we're able to manage our mental health.
Thank you for listening. We hope you have found something that will encourage you and those around you to move towards changed faces and changed lives by growing in better states of mental health together.